Excited to talk about. So what I'm going to do first is I'm going to go ahead and share my screen and see if I can get there. And it says the host has disabled screen sharing. So I didn't know if anybody would be available to show the slides that I have available. I believe I sent it to Nicola. And I'm just really excited to hear about the different presentations that we're going to have today. Really appreciated the presentation from Mr. Halcrow and just the different opportunities that enable us to be able to create a wonderful community, and not only now, but in the future. So I'll go ahead and there we go. What I'm talking about today is managing online health misinformation in the infodemic era. And before I even get to all of that, and I don't know if Nicola, if it will allow me, I think it's yours. If you could go to the next slide for me, please, that would be great.
Hi, Dory. Yes, just one moment.
Sure. And so I want to begin with this. I very much believe in community engaged teaching. And I believe it's really powerful when you bring students in with new perspectives and fresh ideas, and you get them to connect with industry leaders and then provide a service for the community, something that's meaningful, something that's tangible, and something that they can remember. This is what I believe in doing in all of my classes. This is actually the community engaged project I put together last year. And these are my students from my strategic communications classes. And what we did was we rebranded 4 small businesses and nonprofits. And that's because oftentimes small businesses and nonprofits don't have enough money for promotions and strategic communications. So my students put together these rebranding efforts to be able to help them with their strategic communications. You see them here at UWIT Comms. We worked with a marketing agency so that they could work and see the real life skills that happen with graphic designers. I picked this company specifically because this company employs a lot of UAA students. And so that's wonderful to see. You'll see my students here, we're at Kaladi and we're talking about brand voice and brand personality. And you can see our students getting very engaged with the lesson. And this is the kind of learning I believe that is just absolutely phenomenal and powerful. Community engaged learning. And Nicola, next slide, please. Now, as we know, that's quite different this year. And when I was putting together the class this year, we had to reimagine things in a different way. As we all know, on January 30th, 2020, the World Health Organization declared COVID-19 a public health emergency of international concern. With that, they had warned of an infodemic, this proliferation of information, too much information, misinformation as well, disinformation, malinformation, and they suggested communication as a public health intervention for this infodemic. And they said it's never been clearer that communication is an important public health intervention that contributes to controlling pandemics alongside epistemology, virology, and clinical management. Now, this is really meaningful for me because my background is in a broad array of communication. I have a background in communication, rhetoric, broadcast journalism, public relations, marketing, and marketing communications, and branding. So all of that. But at the same time, my research area happens to be in media and in health communication and health campaigns and public health in general. And this is what we do. We create interventions, and this has been my research agenda for close to a decade now. And as we speak, I'm part of the COVID-19 research response team at UAA. And what we're doing is we're doing behavioral health research at the municipality, and we're helping to inform municipal mitigation and response of COVID. And I'm also part of the Municipal Integrated Communications team, as well as the DHSS COVID Integrated Communications team as well. So it has been a very busy time during this pandemic, but it's all meaningful work. And next slide, please, Nicola. So what do I mean by infodemic? Just open up Facebook and you know what I mean. It is just a lot of information, and you'll see this throughout, and especially in the comments and what I call the public arenas of conversation, especially online. And you can see the comments range, everything from just general emotions that people are feeling to now where we're getting to the tricky part, information related to the pandemic. And a lot of it is wrong. And yet, this is part of the public conversation. And people who might be looking for information related to this can see what the public comment is and the general conversation surrounding this. So we knew there was a need, a great need to be able to address misinformation online. And next slide, please, Nicola. So this was the big question. How do you begin to manage health misinformation? Well, first of all, you need credible and trusted information, right? The right information that people can use to base their health decisions and health behaviors. Next, you need credible and trusted sources. What kind of credibility do these folks have? Do they have a background in this area? And next, you need a mechanism to be able to, well, basically alert about misinformation and respond. So, and next slide, please, Nicola. And so this was the big idea, this idea of being able to create a public health information response team. Now, last year at the Alaska Public Health Association, we heard from the group Shots Heard Around the World. And what this group does is exactly that. This is a group of basically folks online, and it's from a broad array of public health and healthcare backgrounds. And what they do is they help defend clinics, mostly pediatric clinics, should they have misinformation on there and should they be attacked when they decide to promote vaccines. So what happens is you send an alert to these folks, Shots Heard Around the World, and what they do is they come in as sort of a digital cavalry, and ones that will come in and to help defend not only your clinic, but also the healthcare professionals working there and the reputations of the folks who are working in this area. We also did something similar when we were doing the Smoke and Tobacco Free initiative at UAA, and one of my students actually helped put together as well in terms of a strategic communications and health communications campaign. And so what happened there is that we did, as part of our strategic communications, we also had Facebook. And on our Facebook, we had misinformation, we had very vocal opposition, but at the same time, we knew where the data was and where the data was taking us. And we knew that most people, the large majority, supported this at UAA. And so we had a similar one where we had folks come in as a digital cavalry, if you will, to be able to respond to misinformation during that Smoke and Tobacco Free campaign. So these were the sort of the inspirational pieces surrounding this public health information response team. And next slide, please, Nicola. Okay, so we needed partners in all this. It's a community engaged project. So we wanted to bring a whole bunch of people in together. So where do we start? Well, we start with my class. And this is JPC 362, Principles of Strategic Communications. And in this class, we so happen to teach media monitoring, social media monitoring as well. We also teach crisis communications, reputation management, and so all of these different elements we could use, and the students can learn at the same time. So it was this perfect fit. We also had the UAA PRSSA group, happened to be the advisor to this group, and this is the Public Relations Student Society of America. And so the group was very eager to take part in this as well. And then, so in addition to the PRSSA group and the students, then we had the Alaska Public Health Association, and they were the ones who were going to be responding. And then we had support from DHSS, ANTHC, PRSA, and UAT Comms, who would produce these creative assets. And next slide, please. And then, so what did we need to do? Well, we needed to get this done, but how exactly? We knew we needed to achieve all of these different objectives, but how are we going to do that? And how are we going to focus on that? And next slide, please, Nicola. And so this was difficult because not only was this not a synchronous class, it was an online asynchronous class. And so that was the challenge. But what we did was, as a group, we put together 12 sites that needed to be monitored because these sites created this public conversation surrounding what was happening with COVID, and some of the misinformation happened to be quite heavy on these public facing sites. Next slide, please, Nicola. And so that's the first part of the process. The students would be doing the social media monitoring and listening. I put them in groups. They monitor these 12 Facebook sites. They put together what they found on Google Sheet, and then they sent a remind text alert to let us know when misinformation was found. Next slide, please. And then what happens next is then I receive all that information. I take a look at the Google Sheet, the student alerts, and then I send that over to the Alpha members. And it is the Alaska Public Health Association members who respond. And they respond with both empathy and education. And that's sort of the core of our response team. And then again, all of this support from the following partners. We have an integrated misinformation team, and we share information, and Comms helps to produce these creative assets for the online social media posts that our members can use later on to be able to respond to some of the misinformation, and then also post things on social media that would help engage folks in the conversation. Next slide, please. So this is what a Remind app alert looks like. It's basically a classroom app alert, and then my kids use it for junior Nordic as well. So we know about the ski conditions and when their coaches are going to be meeting with all the skiers. So, but it's a way for you to send a text message. And what we do here is we actually link directly to the comment ID, because as you know, there'll be a lot of comments, sometimes more than 100. So the students actually find the actual comment of misinformation, and they link specifically to the online comment ID. And next slide, please. This is one example of engaging with empathy. So, and then this is misinformation regarding fatality rates, and not only that, but the vaccine being mandatory, the COVID vaccine being mandatory. This is Dr. Tom Hennessy. He's the former director of the CDC Arctic Investigations. He's also a medical doctor. He also happens to have a background in infectious disease. I think he knows what he's talking about. He's a trusted source, and he is providing credible information that people can use to make informed health decisions. And next slide, please. So this is another one by Dr. Hennessy, and he's talking about the effectiveness of masks and why it's so important to do that. And people are posting about masks are not effective, but here he is providing content expertise as a credible source. Next slide, please. Oh, and next slide, please, Nicola. Is it? And in our next slide, I wanted to show you some of the creative assets. Oh, the next one. Let's go back to that one. So some of the creative assets the students produce. Oh, okay. So these are just some examples of the creative assets that the students produced for social media. The first one had to do with flu shots. They had a very specific demographic they needed to target. This one over here, it was for Instagram, for that specific platform. The audience here they needed to target was a much younger audience. And then the next slide, we see some more digital assets related to this idea of charging yourself up during the pandemic. And that's because you needed to balance things out, right? And so these are all very hopeful in terms of the tone for this, but these are just some of the creative assets that the students produce. And next slide, please. And so the other component we had to this is the community engaged student assistant. And this student assistant really will be assessing this response from the Alpha team members, what worked, what didn't, and also doing additional research related to misinformation and just some of the things in terms of response that we can work on in the future. And really to help share our work, we're going to start putting together presentations, publications, a literature review. So very much appreciate the work of the community engage assistant who will be helping us with this project. And next slide, please. And so the timeline for this, basically this semester, it's funded by the community, by CCEL. And then next semester, DHSS has also come in with funding. So we're going to continue this project in the spring. So this is exciting. And also in the summer, we also plan to continue as well. Dr. Garcia and I will be teaching this co-high course. It's basically an undergraduate and graduate course that's stacked during the summer, and it's going to be called Media and Public Health. Next slide, please. So we needed to do something. The infodemic required action right away. I mean, we could have studied this for a while, but it really couldn't wait. One of our team members from ANTHC said it best: "We are building the plane as we fly it." But really, it's all meaningful work, and one that we believe will have a great impact in the community. In the future, we're going to start to look at live feeds in terms of misinformation. We're seeing a lot of health misinformation in the live feeds, and those are much harder to monitor. We're also going to make the use of Google Trends. So we've been working with Google Labs a lot to look at some of the information related to Google Trends, Google Alerts that will be helpful in our initiative. And then of course, more collaboration. We welcome collaboration always, and it's fantastic to be able to come together to work in this specific way. And next slide, please. And so in terms of closing, we still have a lot of work to get done. We know that there are many needs out there, but we're doing what we can and playing our part to help during this pandemic to be able to bring credible health information to people who need it most. And I'll pause here for questions. And I want to take the time to thank Vice Provost Whitney, Nicola, for their support with this project. Really appreciate the support that I receive from the Center for Community Engagement and Learning all the time. And my students are so thankful as well. I also want to give props to our awesome academic innovations folks, the folks over there, Stacia and Katie, and the folks who helped with the online asynchronous course, just because we were taking a face-to-face course and we were making it online. And we were really hoping to deliver, I was really hoping to deliver a great value for our students, that's something that they can be able to put on their resume, something that's meaningful for our community, and to bring all of that together. And I think this project, this class project, has a lot of promise in that area. So thank you for your time. I appreciate it.
Thank you.
Wow, Joy. So great, right?
Yeah, thank you so much. We're just a tiny bit short on time. And so I'm wondering if folks that do have questions, maybe it would be okay if they contact you directly through your email address that's just been shared. Thank you so much. Just so that we can stay on time for our break, which will be after the next presentation, I'd like to introduce our next speaker, Amber Christensen-Fulmer, who is the Director of Native Student Services, and she's going to be talking to us today about supporting Indigenous knowledge systems within a behavioral and academic model. So if you're ready, take it away.
Thank you, Brittany. And I just want to make sure everybody knows we're not doing a PowerPoint today. I'm not a PowerPoint person, just not. So also, I was talking with Paula, because Paula's going to be co-presenting with me today, and Quentin is here as well. So most of my staff are here, so welcome them. We were talking about how we were going to do this today, and we were talking about not having PowerPoints. And I actually really enjoy not having PowerPoints. And as a professor, I've never really been one to do that anyway. And now I realize it's definitely a more Indigenous way of doing things, where we come into the room and we talk about things and we have more of a conversation instead of a direction or a teaching moment. So, that's my excuse, and I'm sticking to it. We're going to do this in a more Indigenous way today. So thank you for having us. Just a quick introduction for those of you who don't know me. I'm Amber Christensen-Fulmer. I am the Director of Native Student Services. I started as the director in January of this year, and very quickly ended up being the director in a pandemic. So we are building a program, and I really enjoyed Joy's quote that we're building the plane as we fly it, because man, I bet you my staff laughed at that when they read that, because that's what we're doing. We're calling it agile project management is what we're calling it. So this whole year we've been focused on how are we going to support Native students on campus. And when I interviewed for the director job, it's funny now. It probably wasn't funny then. During my interview with the chancellor, I said straight to her, you posted this as a business job, a business position, and it's not. It's not a business position. And she laughed and said, "Well, let me ask you my 5 questions that are business forward." and I thought, well, for sure, not going to get it, and I got it. And we talked about what it means to turn a unit or a program per se to from being a business forward to being behavioral health forward, and why that would be important. And so when I came in and I really looked at the data for our Alaska Native students and what was going on, it's not good. And I don't have to go into the details of it. I'm sure you guys have heard it before. You can look it up easily with institutional data. But the number I'll give you is over the last 6 to 10 years, we're at a 90% dropout rate. So we have a 10% graduation rate for Alaska Native students for all things, for certifications, for associates, bachelors, up to PhDs. And we just got the updated information. We are now at about 108 Alaska Native PhD holders of all time across all disciplines. And so when you think about representation and connection, which is something that our students are saying they're lacking on campus, that's a big part of it. Is we do not have a great representation of Alaska Native professionals with higher education on campus, and that's largely because we just don't have the numbers, which is where we're coming in, because if we can't get them through their first couple of semesters, we can't get them through their PhD. And so my staff and I have been working really hard to develop a program that focuses on the needs of our students to keep them here past the first and second semester, because that's where we're losing them, is the first and second semester. And so I developed the Native Early Transition Program. We had Native Early Transition Program when I came in as director, but it was a week before classes started. Students could come in and they could get accustomed to campus before the big busyness of the school year started. And I think that's a great idea. And so we kept that. And now it's a transition week from Quentin doing his work on the front end for recruitment, and then handing them the students that come into the NET program off to Paula and I during that week, so that Paula and I can welcome them to campus and then get them settled into the NET program. So what did I focus on? I focused just at house cleaning, so you know what the program is. The NET program is focused on the first 60 credits, the GERs. Right now, mainly the writing and the math portions. That's where our students are really struggling. And so we're looking at things like writing ALPs and math ALPs. But really what we did was work with Dr. Sarah Buckingham in the Community Clinical Psychology Program and the Cultural Identity Project to really talk to students and be responsive to what they're telling us they needed. And a lot of the academic stuff is what they're telling us they needed, but more than that, they were telling us they needed to connect and be represented, and they needed to feel like not only did they belong here, but that they were wanted here and they were valued here. And that's where behavioral health came in. I did a lot of talking to students. I did a lot of talking to faculty and staff. I did a lot of talking to a lot of people as we were developing the program and putting in the supports. So why do I refer to it as an academic model built on a behavioral health model? It's because it is. My background is behavioral health. My background, both academic and professional, is multidisciplinary treatment teams and running them. And when I worked in law enforcement, my last 5 years, you had to have a felony domestic violence and a felony sex offense to be on my caseload. And I still managed to help reduce recidivism on that caseload by 30% by putting some of these standards in, putting some of these techniques in, these foundations in for people. And really it's support. It's asking people what they need and providing that for them. But fundamentally, as a university and as an academic, we have a responsibility to do the research ourselves and find out what is really going on with our students, and fix it ourselves. We can't just rely on students to tell us what's wrong and then them be fully prepared for college and just take off right away, especially when you have students coming in from rural Alaska that have a village of 500, 1,200 people, and now they're coming to campus and they're one of 1,500 Alaska Native students on campus. So there was a lot of things to address. And so we worked on addressing welcoming students to campus, and now we're really focused on beyond the grades. I don't care about their grades, and I just don't. I don't care about their grades. I'm focused on retaining them until next semester. We're focused on connecting with them. Paula does a ton of rolling check-in calls to just say, "Hey, what's going on with you?" and providing resources and providing that connection and showing that we care. Then we care about you as a person and as a whole person more than we care about what grades you're getting. And I think that that's a different way of talking to students, because at first they don't trust you. They kind of are like, "What are you saying to me?" But the more you say it, and the less you talk about grades, and the more you talk about what's going on with them outside of the university, outside of their classes, what's going on with them in their classes, and talking to them about how to engage with professors, how to write emails to professors. Is it okay to write their email? Talking to them about what fairly is their responsibility and what is fairly the responsibility of their professors, and really being advocates for them when they are struggling, even if they have responsibility in why they're struggling. Making sure they understand that everybody struggles. Nobody knows how to be a college student right off the bat. Everybody has to learn it. And, some people learned how to do it earlier than other people, but that doesn't mean that you can't learn how to be a college student and be here. Some of the exciting things that we're working on before I hand it off to Paula, Cheryl and I are talking about putting together a elder learners group so that we can start recruiting elders into the NET program so that we can have a fully multi-generational cohort model, and providing a group weekly for elder learners so that they can come together and they can talk about the specific things that impact them as learners in the community, because it's going to be different than 18-year-olds. It's going to be different than single parents, and so I really see NSS and NET in terms of building this academic support on a behavioral health model as really focusing on that whole person and being honest about the fact that this is a sacrifice for students to come here. Not only are they paying to be here, or they're having their native corporations pay to be here, that they're sacrificing their time, and they're sacrificing time away from their families and from other things to be here. And I really hope we can change the mindset of that people come here and they owe us something for being here. That's not the case. They're here, and we're here to serve them, and help them get through this, because most of our Native students aren't coming here to be millionaires. They're coming here to help their communities. And so really understanding that this is much more than them wanting to be the slickest attorney in town. They want to be an attorney so that they can fight for land rights and sovereignty issues and subsistence rights. And so it's more impactful for them to be here than I think we give it credit for. So at this point, I kind of want to turn it over to Paula, because I'd like Paula to talk to us about coming from a rural community and some of the pressures that she experienced as a student, as a Alaska Native student culturally, because I think that will help people understand what our students are going through. So Paula, if you could step in here.
Good morning, everyone. It's great to be here today. I will just briefly talk about some of my experiences as a college student. I just graduated with my bachelor's in human services in May. And I actually completed my capstone project at Native Student Services, which just kind of changed the trajectory of where I saw myself going, and what I'm focusing on. And really has helped in the way that I work with students. You know, coming from a rural area, it is very different. You don't necessarily feel as though you belong, which is something that I found in my research that I did through Native Student Services, and by speaking to the students that utilize that space, um, and asking why they come to that particular space and why so often. And it was that they felt that that small space that Native Student Services has was somewhere where they felt that they belonged, somewhere where they could go, where they felt understood, not only by other students, but by staff members as well, people who look like them and have the same background and experiences as them. So when it comes to the way that I deal with the students in our net cohort, is from that mind frame, you know, and I understand that mind frame because I come from that mind frame. I come from a small indigenous community of, 500, 600 people, where it's the same faces that I've seen my entire life, who know my entire family. And so, you know, I sit down and I talk to them, and I try to learn about their strength. The first thing I do is try to make that connection piece. What do we have in common that that can tie you into me, and just really connect you with me and get you to trust me. And that's just by giving them time to acclimate to this new environment and a new way of doing things, and letting them know that everything is okay, that the way that they think, where they come from, their beliefs, their traditions are all okay, and that they can be successful in post-secondary education by utilizing some of those strengths that they come from. And one of the things that we run into a lot is that, um, and from my experience, I've completed my bachelor's degree, and I plan on pursuing my master's degree. And I have some of my family members saying, no, that's enough. You've got an education. That's enough. You know, and that goes back to some of the traumas that Native people have experienced through boarding schools and things of that nature. And so they are really truly fighting two different fights. One where they do want to pursue their education, but at the same time, they want their family and their community members to know that they are still committed to them. And that's the crazy thing, is they have to pursue higher education, their bachelor's, their master's, and PhDs, in order to get into those positions where they can actually make decisions that benefit themselves and their communities. And that is what we're trying to get them, not only the students, but other members of their communities as well, to understand, is that going into post-secondary education does not mean that they are leaving themselves behind. They're not leaving their culture. They're not leaving their regions and their past and their values, but that they can use this type of education that is needed, unfortunately, in order to go back home and help their communities in the best way that they possibly can. And so we're really trying to instill that into the students as soon as they get here, but doing it where they are at. We're meeting them where they are at, and we're encouraging them. And we are that support system that they can learn to trust and rely on throughout not only their first semester, but hopefully through their entire post-secondary education. So I know I'm short on time, so that's where I will end that, and hopefully that will leave you guys wanting to know more about our programming, exactly how we're working with our students, and some of the benefits that we're seeing from it already. Thank you.
Brittany, I think we rolled in right on time. You gave me the 1-minute warning. Look at that. Paula's a rock star. Yes.
Very, very nice, you guys. Very nice.
Truly incredible.
So if any of you guys have any questions, to be mindful of time, get a hold of me, get a hold of Paula, get a hold of Quentin. We'll give you our email addresses, and please come talk to us. And if you have any questions about particular Native students, or a student you're worried about, hit Paula up. Paula will make those calls. She may already know them. She's got the casework stuff down for Native Student Services. So if you need us, we are here. Thank you for giving us time to talk about what we're doing.
Thank you so much for sharing that important and incredible work that Native Student Services is doing in such a short time since you've been here in that director role and during such a difficult environment in which to do so. We really appreciate that work and sharing it with us. Let's go ahead and take our 5-minute break, get more coffee and tea. Let's stretch our legs. And when we come back, right at 10:30, we will move on to a presentation from Sarah Buckingham.
Welcome back all.
Everyone.
Brittany? No, I was going to say I'm just getting things started again. Hand it back to you.
Awesome. Thank you so much. We're all right on the same page here. So it's exactly 10:30 according to my clock. I want to be mindful of folks' time and move into our next presentation. So I would like to introduce Dr. Sarah Buckingham, who is professor of psychology, and she's going to be speaking with us about community engaged research during the pandemic. Thank you, Sarah.
Thanks for having me, Brittany, and lovely to see everybody here today. It's such a joy to hear about everybody's work and the exciting things happening here during the pandemic and during these strange times. So thanks for having me. Today, I wanted to just give you a snapshot of some of the things that our research team has been thinking about and doing during the COVID-19 pandemic, some of the lessons that we've learned and some of the really unexpected opportunities that have come out of these strange times that we're all living through. So if you could go to the next slide, Nicola, and maybe, can you change it? We see, and maybe you can swap the displays. We see the presenter mode on your end. Perfect. Yep, that shows up good. So today I thought I would share with you about our research collective. Then we're going to move very quickly into lessons that we've learned across this time. I'll give you a couple case study illustrations from studies that we have going on right now, as well as final recommendations. Next slide. So one of the most important questions in my life that's ever been asked of me was a proposition of what would happen if we changed the question from what do you do research on to who is your research responsible to? And that is the way that we view the community engaged research that myself, my students, and our community partners do. And so we've named ourselves the Crossroads Research Collective. We're not Buckingham's Research Lab or anything like that, because all of our work is truly done in the community. And it's done at the crossroads of a lot of different things. So we cross paths with communities and universities. We're at the crossroads of quantitative and qualitative methods. We're at the crossroads of research and practice. And so all of the work that we do is very community engaged and is intended to answer the questions that our communities care about. And a vast majority of the work that we do is actually physically in community spaces, which is what led the pandemic to be a big challenge for us. Most of the work we do is face-to-face and collaboration in community settings and not in digital spaces. And so we've had a lot of learning opportunities over the course of this pandemic. Next slide. So the lessons that our collective has learned today that I'm going to be illustrating through just a couple of cases with you are partnership. So being able to value and truly value the experiences, skills, and perspectives of everyone involved. Technology, which is using technology to your advantage, but also identifying when you need to modify your technology and when technology doesn't have time and space. Responsivity, so adjusting to partners' capacities, needs, and desires over time, as well as flexibility. We should all be expecting change and designing change into our project so that it can be responsive over time. Transparency, and by transparency, I mean open communication at all times with all partners who are involved, which is a lot easier said than done. And timing, so knowing when it's okay to press pause on a project and when it's necessary to adjust and move onward. And I'm going to be illustrating these 6 main lessons with 3 different projects that our team has going on right now. So next slide. The first project that I wanted to share with you is actually one that Amber had mentioned in the presentation before mine, which is something that we call the Alaska Native Cultural Identity Project. This is a project that's been many years in the making, and is an elder-led project that is intended to help facilitate students' behavioral health as well as persistence and academic success through identity development that is facilitated by Alaska Native elders from across the state. We've been working on this project for a number of years, and we're funded by the National Institute of Health. And right when the pandemic came to a head was when we were starting a randomized control trial of the intervention that we had developed. So we had intended to have an 8-week project where students would actually come physically into Native Student Services, and we would be having talking circles, meals together, cultural activities, all intended to support identity development. Now, this was led by elders from across the state. So as you can imagine, with at-risk facilitators, we had to completely stop this project and not even begin the trial that we had started. And our team spent so much time talking with our community advisory board and our elders and our team members all over the course of the summer, thinking about, is it possible for us to actually make this work? How are we going to run this in a pandemic with doing a lot of things that we intended to do in person? And here's where the lesson of partnership comes into play. By talking with our elders who are facilitating this work, we realized that a lot of our fears around trying to move something into Zoom and into a digital space were actually overblown, and our elders felt very competent in being able to do this work. And so we ended up changing our intervention modality, and we just did the first round of our trial this fall semester and found out that actually Zoom has worked really well for our intervention for all of the limitations it's provided as well. We've also had a mixed blessing, and this is where technology comes into play, where we've been able to include students from across the state and from different campuses in our program because of COVID-19. We have a number of students who have been joining in and are part of our intervention group this semester who live in diverse areas of Alaska and still have been able to join, and whereas before they might not have been able to come to campus and participate in this intervention. And we were also really able to use technology to our advantage. So we were able to use DocuSign to get informed consent signed, Zoom to facilitate the intervention, Qualtrics for the survey data we're using, Zoom to do focus groups, and even doing a lot of work from our homes, being able to text participants and that sort of thing and ship all the materials out. And so technology has really been able to facilitate some beautiful things for us in this project. And by collaborating with our partners from the get-go, we were able to make all of those transitions happen over the summer and do a really good randomized control trial this year. Next slide. So the next project I wanted to talk to you about is actually one that's been funded by CCEL. So we're very thankful for that and the CISAs that we've had that have been involved in this project. This is called Working Alongside Refugees in Mental Health. It's a multi-component project, but essentially it aims to develop our behavioral health care workforce to be able to better work with forced migrant populations. So including refugees, asylum seekers, and asylees. And the way that we are building up our behavioral health workforce is through a series of trainings and a provider network where we were offering specialized training in providing services to refugees. So things like working with interpreters, understanding what forced migration is, how to do asylum evaluations. And we were doing all of that, of course, in person in the past. And we came to a head with the pandemic and no longer being able to offer in-person trainings. And here's where the lesson of responsivity comes into play. In talking with our providers, we realized it wasn't so easy to simply transition this onto Zoom. A lot of our providers that we were working on training had a lot of Zoom fatigue. They transitioned solely to telehealth. They were exhausted of sitting in front of a computer screen for a long period of time and had incredibly busy schedules because of the pandemic. And so here's where we actually decided to take a bit of a pause and modify the work that we were doing and not just try to force our continuing education into a Zoom model. So we changed our focus and we opened up the opportunities that were available to providers to different training opportunities from across the nation and actually internationally as well. And then we redirected the work that our team was doing to make engagement more feasible for folks. So we had some funding through the Alaska Mental Health Trust and also with the Community Foundation. And we were able to redirect the work we did by working with those funders to say, what do we need to do as part of this project instead? And so instead of these in-person trainings, what we did is our team started to focus on how can we make psychoeducation materials available to our providers in lots of different languages that are friendly for the work that they're doing with clients. And so by talking with our partners and choosing to redirect our energies of our team as well as our funding and being flexible with that project, we've been able to continue on the work of working alongside refugees and mental health during the pandemic. Next slide. And the last project I wanted to share with you is one that we call Untapped Talent. So this is a project that we're doing with the municipality of Anchorage right now, and specifically with Welcoming Anchorage, looking at how can we transform the municipality in order to better include and integrate all of our immigrant community members. Oops. And this is a mixed methods project that we started last fall with the intention of doing a survey with a broad array of Anchorage residents, and then moving into focus groups in order to better understand what do things look like in people's lives. Here we were partnering with peer health navigators and health promoters in the community to recruit folks to participate in this project and really reach out to everyone in the community. But we started data collection at the very end of January in 2020. And so as you might imagine, we hit the ground running, things were going really well, and then the pandemic hit. And it was no longer safe to work with health promoters to go out to people's homes, and we didn't want to do research in this way. So we had a change in our procedures and moved to online and telephone communication in that way. And that created a lot of limitations for us. We ended up recruiting lots of people to participate in the survey who were already pretty well connected in Anchorage, and we missed a lot of people who we would have otherwise had involved in our project had we continued to be able to work on the ground. And so here's where the lesson of time comes in. We decided to completely modify our timeline and be flexible with ourselves and build things out so that we were able to gather the data that we really needed for this project. And then here is the lesson of communication. This project has now spanned out a very long period of time. And so Zoom community meetings have been really important to let folks know where we're at with this project, giving updates, sharing back the data that we are gathering as we go along the way, and being able to reach out to more communities. We've also changed how we're doing focus groups for this project, and we've been moving on to Zoom because of the data collection risk that doing our in-person groups has posed. And so here's where technology in some ways works out really well for us. It also presents a lot of important limitations because a number of the communities that we're working with have limited internet access, and focus groups can be really challenging to participate in when you're joining via phone. And so there's a lot of lessons in that I'm happy to talk through and with folks if you're interested in engaging in that sort of work. Next slide. And so here are the recommendations I would leave you with today from our team. The first is to always ask. And I know this sounds kind of, well, duh, this is what we should do. But I think a lot of times we forget to ask important questions and truly talk to community partners and learn the best ways of adjusting our projects. And with asking comes listening. Sometimes we go into those conversations where we ask questions and we're not truly listening to the recommendations that are coming back at us. And we need to go into those conversations with an open mind and make sure that we are flexible to adjust things. We also need to make sure that we collaborate. Every member of your team, whether it is a student on your team, another professor, a community partner, a participant, everyone has different insights to offer, and we need to work in true partnership, understanding each other's strengths and areas of growth. We also need to communicate. And my rule of thumb is always meet slightly more than you think you need to, because the worst thing that can happen in a community engaged project is for any community partner to feel left out. You can always cancel meetings if it feels like you don't have anything more to discuss, but there's a lot of mistrust that can develop when you think maybe you're communicating well, but a partner feels like they haven't heard from you. And then finally, I think flexibility is the name of the game. It's a key to mental health, and a key to research and everything that we do. People's roles change, circumstances change, our needs change, our desires change. The only constant in life is change. And so we have to be willing to respond to that change. And as long as we're willing and we go into things with an open heart and mind and truly keeping our community partners at the forefront, we can create really positive projects during this time. And my last piece of advice is to always prioritize relationships over specific projects. Most of you are in places where you're doing research for the long haul, and you're in spaces where you are hoping to impact your communities in a really positive way over your entire career. And you don't want to wreck a relationship that's really important for you for decades to come and so important to the community. It takes a long time to build trust. It does not take very long to lose trust as a result of miscommunication or pushing research in a way that isn't helpful for a community. And so always prioritize those relationships over specific projects, and the research will come along the way. Next slide. I think that's it. Yes, that's all I have for you. So if you want to hear more about our work, please don't hesitate to reach out to me. And you can also visit our website to hear about all the members of our research collective and the cool work that everybody's up to.
Thank you so much,
Awesome, Sarah.
Thank you so much. So there's so many great things about that particular presentation, including the opportunities that have come up and the ways in which using technology hasn't always been a barrier, which I really appreciate hearing, particularly with regard to some assumptions we might have about older adults. So thank you so much for sharing both opportunities and barriers with us. At the risk of sounding like I'm rushing her out, Sarah actually has another meeting to get to right now. So thank you.
So thank you, Brittany. Please don't hesitate to reach out. And I'm sorry to miss the rest of this conference, but it is the way of the pandemic these days. So I look forward to popping back on after my next meeting is and hearing our rapid presentations.
Thank you so much for taking the time out of your day. So next, we're going to move right on ahead to our next presenter, who is Heidi Brocious. She's professor in social work, and she is going to talk to us a little bit about her strategies for transitioning research interviews into online technologies. Thank you, Heidi.
Thanks, Brittany. And am I sharing my slides, or are you sharing my slides?
Nicola will be sharing your slides.
Great. Super. Well, I'm going to talk to you as the slides get loaded. Brittany actually asked me to share this presentation. My initial reaction was I'm really just bumbling through things down here, and so I'm going to tell you about my bumbling through. But I actually do feel really good about where we're at in the project that I'm going to tell you a little bit about. So, Nicola, when you're ready and those slides are ready, let me know.
Okay, sorry, just 1 minute.
No worries. They're not nearly as pretty. So I forgive me for that. Sarah has better slide talents than I do. Well, first, maybe if you just move to the next slide, let me tell you a little bit about the project. So I'm in Juneau, even though I'm a UAA faculty in the School of Social Work. And we have been doing we're in now year 3 of an evaluation of a Housing First program. So if you're not familiar with Housing First, Housing First is a risk reduction model for housing individuals who have been chronically homeless and who are in the case of Juno's situation, alcohol dependent and have failed in a variety of programs. And so Housing First is what they consider wet housing, where the residents of Housing First they have a efficiency apartment. It is their long-term community. It's not a short-term program. It's not something that you graduate from. It's housing. And the housing is not contingent on whether or not individuals are able to maintain sobriety or whether or not individuals are engaged in treatment. All of those things are offered, but they're not mandatory to participation or remaining housed in the program. Could we get that next slide, Nicola, when you have a second? So we're in the third year of a fifth year evaluation, and this year is really important because actually what happened, just to tell you a little bit of the history. So very contentious issue down here in Juneau, Housing First. Lots of people not necessarily supportive of the initial funding. So we got involved to help demonstrate the positive impacts of Housing First. So in our first 3 years of the project, we were able to really show some community data that showed drastic decreases in ambulance use and in contacts with the police department, ER visits, which really had a positive impact on the community. And in actuality, that data, along with other advocacy, led to the expansion of the program. So over the summer of 2020, they finished up the expansion. It was a 32-bed unit, and they expanded it to add an additional 32 beds. So we now have 64 Housing First beds in Juneau, and we were going to continue to keep up some of the data collection, documenting the success of the second phase of the program. So in September, since September, they've been moving in new residents into the Housing First program. Now, one of the things that's essential about our project is that we catch people right as they come through the door, because what we're doing is we're asking them about feelings, perspectives, experiences, sense of safety, well-being, mental well-being, but we're doing it and we want them to reflect on the month to 6 months before moving into Housing First, so that when we follow up at 6 months, we'll be able to compare their life before Housing First with their life after 6 months and then 1 year of Housing First. So timing was really an issue around Housing First. And this is a very transient population. So when I first went to the institutional review board, I actually asked to try to meet with people face to face, and the IRB said, you can't do that. You cannot do that in the middle of a pandemic. You cannot do that with a high risk population, which I understood. But I also was thinking to myself, how on earth am I going to catch a really difficult to catch population and get them engaged in technology? So as we were exploring those issues, we decided on some technology, but also sort of just to mention, at the same time as people were moving in, there was a pretty extensive COVID-19 outbreak among individuals experiencing homelessness in Juneau. And so amidst all of this implementation, Housing First was dealing with a COVID outbreak in their setting. So this is the context in which we're trying to launch new interviews. So next slide. So am I frozen? There we go. Sorry. So you can imagine the challenge of trying to catch these time-sensitive interviews in the middle of a true pandemic, right? Not just the general pandemic, but the experience of the pandemic in the setting. And I'm going to go back to what Sarah really emphasized, which is this idea of relationships. What saved us in this project was our relationships with the agency, because they'd had several years of time working with us, and they'd experienced the value of the work that we were doing. There was really high motivation among the staff, not just the leadership, but just the direct day-to-day staff to remain engaged in the project. They were willing to problem solve with us because they saw value in what we were doing. So having champions, people that were really committed to this as a priority for work around also the work that they were doing, was really essential. And that came from our long history of relationship with them and our engagement in sharing back the data. And I also want to say that not only were we sharing back data with the program managers, but we shared back data with the residents. So not only do we have staff in the building that are committed to our program, but we have tenants that were in the first round of the research that can talk to the new tenants and tell them about how they felt like this process was beneficial. So those relationships really saved us. That along with the impact of our research, people felt like people understood why this research was happening and how it could add value to the program. And for that reason, they were committed to making it happen, even under the most challenging circumstances where residents of the facility were quarantining. They were all dealing with, really difficult issues of communal living in a pandemic. And yet they still really prioritized this research because it was important to them. And I think that was really the key. Next slide. So after relationships, I would say that the next big hurdle that we had to overcome was this issue of technology. And I can't say enough about the value of investing in dedicated technology. So specifically what we did, and fortunately we were funded, that's a funded research. So we were able to purchase an iPad that was dedicated to this project so that it didn't rely on the computer of some worker that was there or having technology that we didn't have control over. And we were also able to add to that iPad the backup of having not just the Wi-Fi that existed in the building, because the Wi-Fi in the building wasn't great. So we were able to actually add a plan where we were able to use cellular data too. So, obviously default to the Wi-Fi, but if that Wi-Fi isn't working well, we had a backup plan for connectivity. And that's been really helpful because, as I said, the Wi-Fi in the building is not great. We prepared participants part of our orientation once we meet with them, and I'll go over this process just a little bit, but we prepared them for what to do if it fails. If we get disconnected, here's what I'll do. If we get disconnected or you can't understand me, here's what you should do. So learning how to sort of prepare and orient the participants as a part of the engagement was also really important. How they get back on, who they go see if they can't get connected. I put this on here, keeping a sense of humor, because, it is a weird place, the online realm, right? So sometimes people freeze and sometimes people get distorted. And so keeping a sense of humor, engaging those participants in, sort of the irony that is our circumstance, I think has been helpful in getting not just the agency to be on board, but the folks that I'm interviewing to feel sort of committed to the interview, even when it's not going well due to technology. And then we also had the agency dedicate a space. They happened to have an office that they were able to set everything up in. And that's been helpful too, because then there's a spot where our stuff can be stored. There's one link that people click on in order to get into the Zoom room. There's a set Zoom room. The link is always the same. So having some of those structures in place around technology has been really useful. And I know that's not possible in every situation, but I think these have been really important pieces to managing the challenges of technology. And then the last sort of piece that I would say, if you move to the next slide, that's been really helpful to us is the organization. So, what this process involves is residents or employees at the front desk of the Housing First knowing who is on the potential interview list, right? And catching these people as they walk in and out of the door. Hey, Frank, are you interested in doing this interview session? Which is kind of challenging. This is not a group that I can say, let's meet Thursday at 2:00 next week. That's not the way in which they operate. It's very much in the moment. And so it really does sort of track back to the staff catching people in the moment and having windows of opportunity where I'm available. So each week, because I'm still working on these interviews, each week I communicate with the staff at Housing First and say, okay, I'm free from 2 to 5, I'm free from 1 to 4. I set blocks throughout the week. And then they have staff that are attending to who are we still trying to capture? And if they see those folks, inviting them in. And that's been the only way in which I've been able to catch people, right? Is having my blocks of time, having the staff know those blocks of time, and then hoping to have the good luck to have folks stroll by during those mini open periods. But the other things that we've done to get organized around that is we have a system of materials. I meticulously made 50 packets that include all of the consent forms, that include all of the releases of information, because they're giving us permission to talk to the emergency room about the number of times that they've been. And then carefully highlighting the places where you want them to sign. And then also being able to visually share those documents. So they have the paper documents in front of them, and then we use Zoom to share, because consent's really obviously very important. And we want to go through that consent with them, but then they have to sign that independent of me explaining. So having it visually available, having it physically available, having a pen in the envelope has all been really useful. And then once they're done and they seal that envelope, that's something that they can give back to the staff that still protects all of their confidentiality. Whether they agree to participate or don't, that sealed envelope goes back to staff. So staff don't know who's participated and who hasn't. That's also a really important ethical part of our IRB. And then we do have one staff in there that is the staff that's issuing the gift card. So that staff does know who's participated. And once participation has happened, then I follow up with that staff and they issue the gift card and track it in the log. So being organized has been really essential to having all the little details that go with research work out. Then I can stop weekly and pick up the consent packets, get those in the locked file cabinet in my office that I'm allowed to visit down here at UAS once in a while, and track and manage the gift cards online. So between those digital documentations and also then the drop-in times, those have been really useful strategies. So I know this is nothing I've said is really revolutionary, and I feel like Sarah said a lot of these things in greater detail, but I really do think that it's boiled down to our relationship with the agency, right? That they see us as somebody whose research is important to the community, important to their agency. They're willing to invest their very stressed time with us. That we've managed technology so that we've decreased the chances of stressors, right, that come with the system, and we have a plan for glitches. And then we've gotten ourselves organized in a way that we don't put as many demands on the direct service staff that are there by having packets ready to be administered. They're in the room, having one person to issue the gift cards. So those are really my concrete sort of lessons learned as I've bumbled around in the dark here at Housing First in Juneau. But I would say that it's gone really well, and we've collected great data, and our project hasn't been slowed. And the same thing that Sarah mentioned too, where you worry about people's willingness or comfort to be on Zoom, the world has adapted in some really remarkable ways. And I think folks that may not have been technology friendly 6 months ago are now more open to the idea of technological communication. And in some ways, this has been less work for me, because I'm able to stay at my office and I'm able to have conversations, secure conversations with the, with the participants, but I'm also able to work while they're not there in a drop-in, as opposed to sort of just sitting around at a recruitment table, which is what I would have been doing traditionally. So in some ways, that's a silver lining that I've enjoyed, which is I can multitask while I'm making myself available to do data collection. So those are my lessons learned in a nutshell, and I would be happy to talk with anybody who's interested. I will also say, just as an aside, these relationships have led to some further inquiry about what kind of research could we do around COVID in Juneau. So the Emergency Operations Command Center here in Juneau has reached out around some other work that they're doing and asking us to document and evaluate that. So again, things that I thought would really maybe slow us down or put a halt have risen up to become new opportunities and new partnerships. And so it's a surprisingly easy transition that we made. So on that note, I think I'll wrap, Brittany. And if there are questions or comments, people are certainly welcome to reach out.
Excellent. Thank you so much. You were able to share logistics and exactly how you were doing some of these things, which I think is really important to all of us. And you did it in such a succinct way that we actually do have a minute or two for questions. If anybody has one, we have almost 5 more minutes before I was expecting us to take our next break. So does anyone have any thoughts or any questions or things they would like to share?
I have one if no one else does, but I don't want to step on anyone else who has a question. Heidi, I'm wondering if you could address, you mentioned, that there had been some reluctance across the community around housing first and those kinds of things. And it's certainly that's something that we've seen in the news when, there are other communities that have worked on that housing first type of initiative and approach. And I would be really interested to hear how you would take the temperature of the community now that things are moving along and so on. Have you seen a move in that community perspective and the general sense of things across,
Absolutely. Absolutely. And I think, one of the things that was important to this is understanding the variety of the concerns. And one concern that existed in our community, which doesn't tend to be the sort of social work orientation or viewpoint, but this was that, why are we spending all of this money? How does it benefit me? Right? There's a sort of sense in our community of like, why when again, this is a perception, when you do less, do you get more? And that was a voice that the community is really struggling with. There was a push to criminalize homelessness, to write citations, and that's sort of where the process started. And so we really kept that in mind in our data collection, because while we certainly collected and were interested in the indicators of well-being, how the residents were doing better or worse, and they really were doing better, we also kept in mind this idea that the community wants to know how this is benefiting them, which in any community, when you get social work philosophy, in any community, when you meet the needs of a part of your population, the whole community does better. So we were very confident that this was the case. We just needed to demonstrate it to them. So we were able to collect information on their use of services, because this was really important. And so we did both data collection on how many times did these individuals use the ambulance? And there was just incredibly stark differences before and after. So a general citizen of the community could go and look and see that, that there were 1.4 fewer visits to the emergency room every day by just housing 25 people in our community. And we were able to contextualize that. Like, what does that mean for you as a citizen? If you go to the emergency room and every day there's at least 1.5 fewer complex cases that are standing in line in front of you, how does that benefit you? So it's not my natural social work sort of bend to think about things that way, but that's what the community really wanted to know. And I think that, so I spent a lot of time talking to chambers of commerce, to business leaders, right, which that was their lead question. And to be able to talk to them about how the ambulance is now more free to deal with to deal with other community needs was really reassuring. And we did see a real pullback from the resistance around it. And in fact, the month that I started on this project, the city assembly voted to ban camping downtown, right? So that was the move that they took in the month that I started. A year later, after we got our first round of data out, the city voted to put $400,000 into the expansion, and they gave the Housing First program a standing ovation in the city assembly meeting. So that's really been reflective of the community movement around frustration and desire to penalize, to a place where data really shows that if we do the right things, we all benefit from the responses. And that's been a really powerful part of this project. It's also what's got these folks in talking to us about doing more evaluation. So if I've got 1 minute, let me just tell you about this innovation that's happening in Juneau right now. So as I mentioned, we had a COVID outbreak among the residents experiencing homelessness, which is a real challenge in a community because homeless people don't have a place to quarantine, and many of them are alcohol dependent. And if you're alcohol dependent and try to quarantine, you go into withdrawal, right? And the only way to treat withdrawal is to have you, at least in Juneau, is to be hospitalized and medically supervised. Well, that defeats the entire purpose of trying to quarantine and keep people out of the hospital. So Juneau is dealing with this really complicated issue of homeless individuals that need to quarantine that also might need to withdraw. And the community reached out to me about a month and a half ago and said, what's done about this? And I said, well, some programs in Canada do managed alcohol. And I sent them some research on managed alcohol. Well, the Emergency Operations Center got in line with the emergency room doctors and began writing prescriptions for quarantined individuals for alcohol so that they didn't have to go into detox, because that was not their intent to quit drinking. They were able to quarantine in a city facility with some managed administered alcohol that kept them out of hospitalization, that kept them from detox, and that kept them quarantined. And the city's been kind of quiet about this because, as you can imagine, finding out that your city has issued prescriptions for alcohol is really controversial, but they want it documented. So we're about to embark on the case study documentation of this process that really helped keep hospital beds free in Juneau during a pandemic outbreak among residents experiencing homelessness. So that's where this research has taken us, but it all has to do with that partnership. So now I'm a minute over, Brittany, sorry.
No worries at all. What a powerful example of community partnerships with student work and research. And it's just really incredible to hear that and how we can change public perceptions about things that are considered controversial, like harm reduction strategies and that sort of thing. So thank you so much for taking that question. We do have another 5-minute break here. So if folks are wanting to go get your one last stretch in, we will come back at 11:15-ish, and we will start a think tank on tactical urbanism and re-envisioning Midtown Anchorage. So let's take a quick break. Thank you.
Well, hello, everybody. I know that was a quick break, and I appreciate you hanging in there and joining us to participate in a think tank. For those of you who have maybe not participated in think tanks in the past with CCEL, this is something we offer periodically. It's an activity where we gather together. It's open to staff, faculty, students, and of course, members of the community. And we usually do it with a community partner who comes to the university with a question. You know, here's a problem we're trying to solve or an issue we'd like some help tackling. And it's an opportunity to kind of brainstorm and engage in some creative thought. And today, Nicola and I are the entity that is asking for your input. Several weeks ago, the Center for Community Engagement and Learning was contacted as part of an effort by the Dowell group, the Dowell engineering firm, I guess I would say, because they were in the midst of working with the municipality on the process of kind of re-envisioning Midtown Anchorage, right? In all different kinds of ways. And there were a range of different folks who were involved in these discussions. And so Nicola and I have been attending these discussions. There have been a couple of other folks from the university attending the discussions, but it's been much broader than that. There are folks who live in Midtown. There are folks who represent other parts of the community that are connected to Midtown, people on the community councils, legislators. It's just a really interesting different group of folks, and everybody is there to think about this particular portion of our community and how we would maybe want to see this portion of the community in 5 years or 10 years or 20 years. And it was part of what made us think about Andrew Halcrow as our keynote speaker this morning, because Andrew Halcrow had been someone who had advanced some projects that involved the concept of tactical urbanism. And tactical urbanism is a development approach that takes advantage of spaces, opportunities, events, and puts them in places where you might not have expected them or might not have encountered them before. So we were introduced to this idea through some of these discussions, and we began to realize that there were some instances of this that existed in our community. For example, Nicola reminded me that that there had been a parking day, and in this case, it's park and then ing is in parentheses. And the idea was to take spaces where people are usually parking a car, but instead think about how that might be encountered as a green space or converted to a green space or used in other kinds of ways. And another example would be, you know, Andrew was speaking earlier about like the food truck pod area downtown, or you might think about things like the top of the K Street garage that's, you know, got all kinds of opportunities for recreation, and people could go and have their lunch there, and, you know, a place where folks could gather in a different way as opposed to just parking cars, right? And so really tactical urbanism is a way of reconceptualizing spaces. And there are a number of great examples of this from all over the country. For instance, in some very urban areas, people have taken advantage of, you know, a lot that might be left if a building was torn down, or, you know, if there was kind of a open space that had sort of just been sitting there and sort of unused, and had actually turned that into a garden. And, you know, we have some great examples of people being more interested in growing their own food in Anchorage, and our community gardens that are on municipal land, like if we think about the ones along C Street, for example, are very well used. There are lots of folks who are doing that, and we've got some of that happening in Mountain View, or up in Government Hill. There's an orchard that's being grown. And so if we're thinking about what do we want things to look like in 5 years, 10 years, 20 years, we can absolutely do something like grow an orchard, right? And so I think when we think about re-envisioning spaces, that's just one possible way of doing it. There are others too. For example, in Midtown Anchorage, a number of us had, coffee outdoors this summer that we may or may not have done in the past. And so we are coming to you today in our desire to do our due diligence, if you will, when Nicola and I return to these continuing meetings about what Midtown could or should look like. We have our own sense of this, and we've certainly listened to the discussions in those groups, but we also want to know, what are some of the folks who are affiliated with the university and with CCEL thinking about Midtown? And so in order to do this today, we have a Jamboard that we will ask you to participate on. And we'll have a chance to think a little bit about this particular neighborhood, this particular region in our community. So in the chat, you will see a couple of links, including some to the project. And if you look at the one that Nicola has shared, that's the Jamboard. And if you have not used Jamboard before, all you need to do is click on that and follow the link, and you will get into the Jamboard. And in the upper right-hand corner, you will start to see the little dots that identify the people who are joining us. And if you're not able to get on the Jamboard, you can use the chat. And we'd like to begin by having people think a little bit about the ways that you encounter Midtown Anchorage right now. It's a part of the community that we all use in different ways. So I just want you to begin by brainstorming about the ways that you currently use or experience or move through Midtown Anchorage. And we'll talk in a second about what Midtown is, but I just want you to, just in your own mind, think about, what do you do in Midtown? And if you look at the controls over on the left-hand side of the Jamboard screen, you will see little sticky notes. You can choose the color of your sticky note.
And I just want to stop for a second. I don't see many people on the board yet. Is everyone able to access that link, or are you running into any trouble?
We can use the chat if the board isn't working for folks, or if we need to change the, good, okay, had to request permissions. Okay, so we might need to just change those permissions so that they're open to anyone.
Yeah, I'll go ahead and change those and repost the link. If you wanted to get started in the chat, we can go ahead and do that.
Great. So yeah, so while she's changing those settings, let's just take this first question, here in the chat. What are some of the ways that you experience Midtown right now? What do you do in Midtown? For example, I shop for groceries in Midtown. Excellent. Do work and kids go to school. Specialty shops, excellent. Yes, restaurants, take kids to karate lessons, great. Yeah, so you can see from the things that we're saying that we do in Midtown, there are a lot of different things that go on. Daryl has said, I shop for groceries and bike and use the park and use the library and attend assembly meetings. I mean, it's a very vibrant part of town. Midtown is a place where lots and lots of things are going on, right? And there are a number of different kinds of entities that are in that part of our community. Yeah, Brittany used to go to the theater. Maybe we will again someday, right? I know that we were, I was driving through the other day and my daughter was with me, my younger daughter, and she said, "Is the theater open?" And sure enough, there were a few cars, but but it was something that I thought was so interesting that it was noteworthy, whether or not it was open. And so Midtown is a place where a lot of us go and a lot of us move through. And so as we've been engaging in these discussions with Dowell, they have been trying to assess what are the things that we're currently doing, but are there things that we would ultimately want to do differently, want to do better? What are some of the hindrances or challenges that we may find in that space, whether it's short term, like maybe the closure of the theater because of COVID, or a longer term kind of a challenge that we say, I would do this more if, right? So let's go to that Jamboard if we can. Hopefully you guys can get into that now. Everybody, I see more people in there. Yay. Okay, so let's start with some of those that we put into the chat, right? People go to the library. People can ride bike. People can ice skate at the park. Lots and lots of different uses for this particular part of our community. So those are a lot of activities, right? Let's think for just a second, if we can, let's scooch all of those. If you can grab a Post-it note and scooch these over to the right-hand side, because they tend to come up on the left-hand side automatically. Let's take a moment and think about, get that, there we go, great. Thanks, you guys, appreciate you helping move those over. Let's take a moment and think about the features that are identified in some of these things, right? For example, one of the features, and again, we can use the sticky notes or you can write something, but one of the features that I notice from these comments is that there are businesses, both large and small, that are here in Midtown, right? What other features do you see that might be part of this? Yes, green spaces, excellent. Any others? Nice. There are sidewalks and it's a pedestrian friendly part of town. There are some gathering places. Like I think about the fact that, we've got Cuddy Park and the library mentioned here, and there are events out on the lawn there. Any other things that you feel are there? One that we haven't really talked about is that Yes, yes. It's a thoroughfare to the rest of the city. Yes, exactly. That there are a lot of roads, right? Some of them pretty high speed, some of them multi-laned and so on. So it is a place where there are things to do, and there are also some traffic issues that may come into play too. There's some recreation opportunities. Awesome. And in a second, we can talk some about some of the things that we feel like might be missing. So let's go to the second Jamboard, and you'll notice up at the top in the center, there's a little arrow that says next frame. And if you move to the second one, I want to think for just a minute with you about how you see the boundaries of Midtown Anchorage. Now, we've started this discussion by me just saying, let's think about Midtown, right? And there are official guidelines, if you will, and boundaries that like real estate folks might think about or that sort of thing. But let's think for a second about how you would define Midtown for you. All of the things we were just talking about, we felt are occurring in Midtown. But when you think of Midtown, what does that look like? And if you go to the next board, which is the third out of the 10, we're asking you to think about the north boundary, and you can use a landmark or a road. The next one is the south boundary of the neighborhood. Same thing, landmarks, roads, other things like that. The next one is the east one. And then the last one is the west one. So take a second and put your boundaries on that north, south, east, or west areas. And you don't have to do them in order. You can scooch around between the different boundaries.
And feel free to take a look at a Google map too if you need. I know I need to.
Okay, so we've got a few responses in there. And there's not, there's not a hard and fast answer to this question, right? It is as I said, there may be, real estate lines for certain areas, you're shopping for a house in area 47 or something like that. But when we think about what happens in these spaces, it can be a little bit more of dotted lines, I guess, even if we might think of it as a particular roadway, right? So then this leads us to the next Jamboard, and that is a question of what are some of the, if we go to, let's see, which number is this one? This one is number 7 on the Jamboards. We go back to that idea of tactical urbanism. There have been some ways that we have experienced different places in different parts of the community over the course of the summer and this time that we've been in this kind of lockdown time, right? Some of them are things that have gone on before, like I mentioned, the community gardens that are along C Street. But on the other hand, Kaladi Brothers at the Black Cup had multiple tables out this summer, or the Kaladi location that's over at Tidal Wave, they had multiple tables out too, so that people could be out in an outdoor environment. Or Steam Dot actually carved out a little space with two parking places, so they had some outdoor space where people could have coffee and enjoy one another's company. So I want you to think about what you have experienced in that area that you would think of as Midtown, and what it's been like, what's been different, what's been the same. Are there areas where you would really like to see some changes? And on Jamboard number 8, you'll see some examples. There are Post-it notes. Excellent. So art, culture, better use of the various green spaces that are there. Yes, things that would be helpful to tourists. We don't really think of Andrew Halker was thinking about downtown as a place that draws tourists, but we don't really think of Midtown as a place that draws tourists, do we? Food truck events, increased opportunities for activities. I think it's kind of a very underutilized part of our community in a lot of ways. Maybe underappreciated is the way for us to think about it. Nice, nice. Small walking groups. Yeah, there are a lot of good spaces that are protected from the elements that if we weren't in the middle of this pandemic, we could make better use of, right? And with UAA coming all back to the more centralized campus along Providence Drive, there will be more space available in the University Center. Oh, community winter bonfires. I love that. I love that. Other ones. Some of these you may have seen as a temporary thing, but they could become permanent. Outdoor dining. Yes, the farmer's market, like the one at the Midtown Mall. Mm-hmm. Okay, Stacy, I see your comment. She's saying she can't add to the Jamboard, but opportunities for winter bonfires in Cuddy Park. The lights and the fire pits. Yeah, it's fine if you it's fine if you add to the chat. Thanks to those of you who are doing that. Yes, yes, G Street to have a festival. Great, thank you, Brittany. I appreciate you adding those. Nice, Mitchell. Thank you for the bike park. I can tell you that in the sessions with the Dowell engineering folks, one of the things that's come up several times was that people had said they wanted to be able to, really utilize the trails to get to Cuddy Family Park and not have to, necessarily cross a lot of busy streets or that sort of thing. And there were some people in the neighborhood, from the neighborhood, who said that there are some well-kept secrets about getting around Midtown. Maybe they should share with all the rest of us. Any others? So the next one that I would like you to, let's see, Stacy, I see your comment. Yes, renaming efforts are helpful. Excellent. Thank you, Stacy, appreciate that. That's right. And we do have, a certain amount of art. Like I think about the fish along C Street, right? The salmon that are swimming upstream toward downtown on C Street. But otherwise, there really is not a lot of, there's not a strong sense of place or Alaskanness or, anything that really differentiates our Midtown from, other Midtown kinds of places elsewhere, right? So I think that the place names and things of that nature would be perfect. BMX tracks for bikes, okay. Skate parks, right? There's that one that's further up in what I would think of as Spenard as a neighborhood, right? And no, Stacy, it's fine. You know I'm happy if a toddler says hi, especially that toddler. I love that toddler. She's darling. Anything else? Okay, so the last piece of this Jamboard or brainstorming kind of session is that we'd really like to know. I feel like on the Jamboard we've probably got the things that we need. So the last thing I'd like to hear is what are the ways that you would really like to see, or the sense of Midtown that you would like to see years into the future? How would you like people to think of Midtown? Would you like them to think of it as, just a place that people commute through, do a little bit of shopping, or do you want to think of it more as a destination? And we'd love to hear what you think about that. No comments?
I'll go ahead and fill some of that space. The reason I was struggling with the response is because I was thinking, how do we determine what are our important destinations? So we just heard from Dr. Hillcrow about how important downtown as a destination is, and how, frankly, when tourism flounders, downtown flounders. And I'm thinking, well, how many destination spots can Anchorage have? And is that the sort of thing we need to focus on efforts in one place, or is it the sort of thing that we revitalize everything all at once? So I guess I'm just sort of toying with how large Anchorage is, as you all know.
That's a great question.
Our Muni is as big as New Hampshire or something. I mean, it's huge. So if you really consider all the boundaries of the entire municipality, how do we determine what gets to be a destination? And is there a strategic way to focus those efforts? So I'm thinking.
That's excellent. I think that's a really interesting, an interesting question. When I think of the community, I kind of think of it, well, I guess I would say not the municipality necessarily, because I'm talking about sort of the core of, the Anchorage Bowl, as opposed to Girdwood to Chugiak and Eagle River. I guess in my mind, I sort of see three major kind of destination points for connection, right? Downtown being one of them, certainly. Midtown being another one. And then the third one being more south side. And I would kind of put that in the kind of Diamond, along Diamond and up onto Abbott Road, right? And one of the things that we've been talking about in that group is kind of the idea of meet me in Midtown, that Midtown is sort of a midway point from, lots of destinations within the community. And that if we do think about the downtown corridor as one that is available to residents, but also to tourists, in a lot of ways, the other gathering points in our community tend to get used more by residents than by tourists. Although we certainly could have more tourism in different parts of the community. Excellent. Yeah, that's a good point. I see that in the chat. For places to become an individual destination, there needs to be something of a scene. Something that draws us, right? Something that draws us there.
I was looking back through the Jamboard to see what parameters folks had put on Midtown. And I don't disagree with them, but it doesn't feel like the university was necessarily included in the Midtown region, but I really think that it could be, right? And as that part of town further develops, I mean, there's strip malls with good restaurants in them. There's land that may become developed. There's good trails. There's, that, I don't know, Midtown East does feel like an area that Anchorage, I mean, just looking at where we have space, that's one of the few places that Anchorage can actually grow. You know, Girdwood's cool and it's got skiing and it's got hiking and it's got festivals, and they're sort of removed and like funky and they've got their own feel, but like Midtown has, you know, has some good businesses that are not just the downtown sort of touristy ones, but that are consistently good year round, right? And that I can imagine growing into those spaces around the university. We've got all these people that, you know, are in both on campus, but then the 2 hospital campuses and then APU right next door. Like there's a lot of kind of perhaps youngish, active-ish folks that are in all those spaces that, you know, like to eat out and like to bike and like to be on the trails, and have a lot of us have, you know, kids of varying sizes that, you know, it's nice to take them out and do stuff with. That I don't know, I can imagine like that part of town growing into, but I don't know that it's there yet.
No, I agree. I agree, Stacy. And I think that what the folks at Dowell and the municipality are trying to figure out is what, you know, what do we need to plan? You know, when Andrew Halcrow was speaking this morning, he said 30 years in the life of a community is not very much at all, right? And so, and Stacy was mentioning her toddler, Olga. You know, it would be great if by the time Olga was a teenager, right, that we thought of Midtown differently. And you know, I think you're right that UMed Midtown kind of connection is a good one. Rogers Park, Fairview, Spenard, all of these have kind of these permeable boundaries with Midtown. And I think all of those communities benefit from the businesses that are there, the recreational opportunities that are there. But you're right, we don't think of it in that way just yet.
Well, I'm going to jump in here. I have had to go in and out, so I may have missed parts that you've already talked about. But so there was quite an effort that some of you may be aware of to prevent the road extension through between the 2 campuses, UAA and APU. And lots of controversy around it for all kinds of reasons. But ultimately, the last round of it, the mayor decided against it. And there's been about 40 years of efforts to get that road to go through. And when the data came in terms of why did it matter so much? Hi, Olga. Very important to have the younger perspectives on this topic.
Right, that's right.
She's adorable. What was the data showed that it would increase the speed by which people in one section of town could get to Midtown and South by 2 minutes or less. And that was why there was so much pressure by people to say, is it actually worth destroying a wildlife corridor, destroying the green spaces connecting the 2 campuses where people do field work in Mosquito Lake and other things? You know, taking out the last remaining green space in Midtown, et cetera, increasing traffic safety issues in our campuses and so on. It's why people organize against it, right? But in that process, there was a whole lot of thinking done about the UMed district, about what it could be, about how we might revision specifically parking and cars. And I'm saying that because one of the downsides to Anchorage is that it's so car-based and that it's so spread out, right? And that people would love to have some areas that are less car-focused. So their children can, you know, do all the things that people mentioned, the green space, the hanging out together, the children having places to go, the wildlife having places to go. And so there's just been a lot of work that was done. I mean, we had massive community forums on this stuff, right?
Right.
And the one that I remember the best, and my memory is overfull at this point, so I barely remember my name from day to day, but had to do with them putting parking spaces, like large ones, in the corners of the UMed district. So people would come, have a place to put their vehicle, and then have public transit moving throughout the rest of the district, because the hospitals are a huge draw, both for patients and for employees. We have a ton of them here, right? The two universities. And the other thing I remember is this discussion about, because at the time UAA had planned to build out into all of our land, right? Between us and APU, they still have it probably on our strategic plan. All these buildings, all these businesses, arguments for them, of course, arguments against them. And one of the reasons we were lucky we didn't do it is because, in fact, we barely have enough money to sustain the building that we did build, which is the Alaska Airlines Center. And people didn't see how we were going to maintain them. And thank goodness we didn't build all those buildings, because now we would be hurting even worse than we are. But to Stacy's point, I mean, like, one of the things that's a problem at UAA is going off campus anywhere for food. You have to get in a car, right? You have to go travel somewhere. You know, so we really haven't thought about us as a community, even in our little zone of the UMed district, how cool it could be if we did develop walking spaces, public transit, restaurants that are near enough that we can get to them that way. So blah, 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 blah. But I'm just sort of saying that there's been a lot of thinking and visioning about at least that piece of Midtown in this same sort of way that could be useful.
Absolutely. And the, you know, one of the conversations that we had as part of that group was, you know, we don't have a particularly residential student population. 94% of our students are commuter students. But one of the things that UAA could be doing would be to, you know, draw students from elsewhere, right? So they could have an Alaska experience and those kinds of things. Those students wouldn't have cars, and you know, and if there isn't an awful lot in the UMed district in the sense of restaurants and that kind of thing, although there are a couple of things like Thai Kitchen and Uncle Joe's and things that are and Taco King over there close to the university. But Midtown is where they tend to go. And periodically students who live on campus they'll do a van ride over to Fred Meyer so they can do some shopping or that kind of thing. But there needs to be that interplay, I think. And I think those are really good points, Libby. Any other comments? Any other things about that space that you would like to see in the future? Relative to the traffic issue, Libby, I would share that one of the things that's been, Nicola, correct me if your perception is different from mine, but I would say a resounding theme that we have heard is that Midtown is too traffic focused. I mean, obviously it's got New Seward Highway through there, but the heavy load of traffic on Northern Lights and on Benson and the multiple lanes makes it a very, very fast moving, just car heavy. And the amount of parking space, I mean, a lot of times lots are half empty, so there may be opportunities to use space in that way that's underutilized now. Right, Brittany, that's excellent. Go ahead, Stacy.
Well, not the parking in Anchorage is one of the sort of biggest opportunities that we have. Like, I don't think that there's going to be a lot of traction for, let's move whole buildings, let's tear them down. But like, could we park more efficiently? Like, probably. That's a much smaller engineering challenge and a much more affordable chunk at it. And so like, okay, the giant BP parking lot there across from Fred Meyer, their lawns are nice, like that's fine. But like, maybe if they had their parking, not great big huge lots, and then, do they have interesting little stores and mixed use, and do they get rid of some of that parking that's next to those big lawns and, on a public transit route that's probably going to stay a public transit route. I think businesses that can see, like, I don't know, a tax break for that sort of development might just do it,
Awesome.
Did like the question on housing too, Brittany, that you mentioned. I think that's an area that needs creative development. I like my single family home because all that in the background, but before I had all that, we didn't live in a house. We lived in a condo style, and I
Mhm. And that was the point that Andrew Halcrow was making this morning too, that, they're trying to create living spaces, affordable living spaces downtown that will bring young professionals to that area who can both, live and work in the area and live, work, and play, right? All of those things. And the same thing could be true with Midtown. And right now, I mean, there are little pockets of some housing in Midtown here and there, but not not in the same ways that we could have it.
Although
Any other comments, or go ahead, Brittany?
No, I was just gonna keep harping on older adults as I do. But there's been an increase in assisted living facilities and a couple of nursing type homes in Midtown. For example, Baxter, was it called Baxter Creek? Goodness, I can't even remember the name of it. There's a beautiful Aspen Creek, something like that, a beautiful new place on Tudor. But it's for people who need significant assistance and probably have a lot of money because it looks really beautiful. And so, just in line with affordable housing is something that Andrew Halcrow mentioned. We have a lot of older adults who are choosing to age in place, and we do not have the community supports for those folks. And those supports might be different housing structures, more pedestrian walkways, and public transport. But there's really a lot of ways to start thinking about how we can support older adults, even maybe connecting it to our university community, right? Ride sharing or grocery assistance. Maybe there's a way, people, a student can live with an older adult and provide some basic caregiving in order for rent. Can we embed daycares and schools in some of these assisted living facilities? Like, I think there's really a lot of opportunity for intergenerational exchanges.
Absolutely. Absolutely. Well, this is awesome input, you guys, and Nicola and I appreciate it. Nicola, anything you want to add to this?
No, not that I can think of right now. I think a lot of what we had been talking about in the working group was raised by this group as well. And I find that very interesting and kind of reassuring that, like, with even a wider group, some of the similar issues and similar envisioning, like where we want to see things, is happening in this group too. So I feel like we're on the right track. That's great.
Yeah, I think
Thank you
so too. Very validating, isn't it?
Let me compulsively throw in what you probably already talked about, which is the climate crisis. Because I think that, I don't know what Biden's plan is because they aren't calling it the Green New Deal, but I think it's something in that same direction, which is to build into all of our new infrastructure the awareness of what's coming, and in terms of the shifts in climate and what that means, and to use every move we make as an opportunity to build in both equity and climate adaptation considerations, and particularly if we invest in anything new, right? And that was the idea behind the Green New Deal, is to provide jobs as we build or redo infrastructure towards protection for people as things evolve. So having that as part of the conversation seems central these days.
You bet. And I was mentioning like the traffic issue. I mean, one of the things that we had talked about was the fact that so many more people are interested in riding their bikes, even through the winter, of course, and that at present, that's not really possible in this corridor that we're talking about, right? Those parallel Benson and Northern Lights are so fast and can be problematic. And so, it's entirely possible that people will, I mean, we do have some more pedestrian friendly kinds of areas. There are actually sidewalks in Midtown. But at the same time, we don't really have just the readily available ways that people could use non-motorized transportation just more on a daily basis throughout the winter. So that's great, Libby. Thank you for bringing that up.
Well, and I always wish, and I know that it's wildly contentious, so it's barely worth bringing it up, but we put together a permanent fund for when we needed it. Guess what? We kind of need it. because my dad was mayor, right? However many 10 million years ago in this town, and he started the people mover system. And the problem with the people mover system is that he could never convince people to front load it sufficiently to make it really, really good, which is what you have to do to get people to ride it, right? You can't wait half an hour or 50 minutes in the cold. You have to wait 15 minutes at the most before people will really do it. So, you know, finding, and Andrew spoke to it, finding the resources. I know they keep cutting it. They cut my bus route, right? I was doing it every single day. And so, you know, where we're going to find that funding or how we're going to front load that. And to my mind, it's just understandable, but kind of painful that we can't figure out a way to use this extraordinary bunch of savings for the entire state to help us, you know, situate ourselves for the next generation to have a good life.
Absolutely. Absolutely. Well, and I think that's actually a great line for us to close the think tank on, is that what we want to do is to make sure that in this particular case, we're asking about Midtown, but we want to make sure that Alaska as a whole is a place that will be available for generations to come, right? And so we appreciate your input in this question, and we will certainly take these thoughts back when we next interact with the group. And if you have additional questions about it, the link to the project with the Dow group was shared in the chat, and we're certainly available to share their information with you as things move along. It's been a really interesting process for us to be part of that. And so we appreciate your input into it too. Well, I think the next thing on our agenda is the rapid fire, right? And so we will have a break for that. Am I right that starts at 12:45?
Yes, that's right.
Okay. So Sarah, welcome back, but we're just about to take a break.
Oh, good timing.
Yes, good timing. I hope your last meeting went well.
It was lovely.
Good, good. Well, we do have rapid fire sessions where people will be giving briefs, 2-minute summaries of their projects that they're working on and those kinds of things. So we'll begin those at 12:45. So there's a good moment here for you to go and, grab a little lunch or, take your eyes off the screen for a more extended period of time. And we'll look forward to seeing you back here in a few.
Nicola,
Thank you.
I didn't email you to ask, and I should have. Did you want me ready at 12:45?
Yeah, since you're here, if you wanted to be the first presentation, that would work out great.
Okay. Thanks.
And I'll ask.
Hello, everybody. Welcome back. We're so glad you had some time away and that you have rejoined this session. We have some videos, I believe, that have been sent to Nicola, but there are also people who may be prepared to present live. And so we're going to start with Stacy Lucasen. And Stacy, I'm just going to leave it from here because I have not done the rapid fires, and so I haven't gotten to experience them. So I'm excited to hear about Stacy's project, and I will set the clock for a couple of minutes just so that if we need to move on, we will, and then we'll have some discussion at the end. Oh, good, Stacy's got her timer. Awesome. Nicola, anything to add before we begin?
No, I don't think so. Each of these presentations will be about 2 minutes, but other than that, I don't have anything else to add.
Great. All right. Well, Stacy, you have the floor.
Stacy,
you're on mute.
I do have unmute in share screen. Okay.
Yay!
Sorry about that. Hi, I'm Stacy Lucasen. I'm here to talk about the Alaska Native birth workers community and just a super brief overview of some of the projects that we are working on. There are 6 of us that are co-founders. One couldn't be pictured in that photo last year. That's Olga being very tiny. So we're a group of Native women, and our mission is to serve Alaska Native birthing families and make sure that they feel supported and well cared for, that they have the information they need to make confident choices about reproductive health, birthing, and parenthood, grounded in Alaska Native values. So we seek to both reclaim and create new ceremonies so that we can heal ourselves and our ancestors and our children, because our birthing practices and our parenting practices have been impacted pretty negatively by colonization. And it's the colonization of all the parts of our lives. So the way that we birth, the way that where we birth, who gets to be there, all of those things. And so it's a big long-term project, but right now, we're working on formalizing and growing a network of Alaska Native birth workers and Indigenous birth workers that are grounded in our values and traditions that are able to offer support to birthing families. And we do this not just because it's fun and exciting and wonderful, but also because we know that there's better health outcomes when families have doula support and have a supportive person present and able to be there just for them, not there for the hospital, not there for the doctor, but there on purpose for the family. We offer free direct services to families. In the pandemic, that's looked a lot like distance services. So we're trying to build our capacity, but then also be providing things that people need right now. That's a nursing bag. We did a pregnancy beading workshop. We've got jars for comfort, food bags. A lot of the families that are stuck waiting in patient housing are stuck because of the pandemic. And so we're trying to provide literal comfort and support, but then also a sense of community. And the donation closet, always looking for things, had to put a plug in for that. But Quiana, for your time, thank you.
Awesome, thank you, Stacy. I think what we probably should do is go through the other ones, and then we'll do some discussion at the end. And of course, and Stacy, I hope you can stay in case there are questions and things of that nature. Yeah? Good. Okay. So, Nicola?
Thanks for joining us at the Rapid Fire. My name is Amanda Walsh, and together with my colleague, Dr. Leslie Redmond, we're going to talk to you today about our community engagement project with a local food pantry and our partnership together. So our partnership is with Catholic Social Services and St. Francis House Food Pantry, and they had contacted us back in 2017 looking for help in determining how their services are impacting their clients. So we have worked over 3 different phases with them in our research study. We've looked at the role that the pantries are playing in helping their clients staying homes. We also looked at food security status of their clients and whether or not the clients could be choosing more healthful foods based on their client choice model. What we learned from that is that the clients, in fact, can make healthier choices, which led us to the 3rd phase of our study, and developing a nutrition education program that is nudging the clients towards healthier food choices. What we'd like to discuss now, however, is the 4th phase of our project.
The 4th phase of our project carries phase 3 forward one step farther and going beyond the nudge and actually using an educational intervention to promote the use of herbs and spices to improve dietary quality and intake of food pantry clients at St. Francis House Food Pantry. We've been fortunate enough to receive some funding from the Academy of Nutrition and Dietetics Foundation, as well as the Florence Science Institute, to help support this initiative. And our idea is that in teaching food pantry clients how to use herbs and spices to improve the flavor of foods, they might be more inclined to make healthier food choices once they know that it can taste better. It would also help them to choose herbs and spices instead of, for example, sodium, fat, and sugar for flavoring. So we're really looking forward to getting started on this project.
The 2012 presidential election had some of the lowest young voter turnout in recent memory. College students between the ages 18 and 24 voted at about a 19% rate, which is admittedly pretty abysmal. So heading into 2016, there was a lot of discussion about how much, if any, impact college students would have on the outcome of the election. In those discussions, oftentimes the lack of voter turnout among young people was attributed to being unengaged and, in particular, apathetic. As somebody who interacts regularly with college-age students, that didn't seem like the whole story. Oftentimes, we see people not turn out to vote, not because they don't care, but because they don't have access to the registration, or they don't have access to information about how and when to vote. So it's not a matter of apathy, but a matter of education. One thing that I started incorporating into my classes, communication GER courses, is a project called Campus Vote Project UAA. We strove to increase student voter registration, education, and turnout in all elections, not just presidential elections. We partnered with the National Study for Learning and Voter Education, and we get our statistics every couple of years to see, are we making any impact when it comes to voter to ensure that as many students as possible were registered to vote, because when you provide registration, you at least leave the option open. As a result of our efforts, in addition to the automatic PFD voter registration, we now have 81% of UAA students who are registered to vote, and that's as of 2018. In terms of voter turnout, we provided as much information as possible about when and how to vote and how to access information about candidates and ballot measures. And we found that in 2018, a midterm election year, 53.6% of UAA students turned out to vote. Now, of course, we'd like to see that higher, but it's certainly a lot higher than the national average, and we feel really good about that. So something that a project like this teaches us is that it's not as much about apathy as lack of education. Margaret Mead once said, "Never doubt that a small group of dedicated citizens can change the world. Indeed, it is the only thing that ever has." I think that a project like this is proof of that.
Hi, my name is Ruby Freed, and I'm an assistant professor of health science in the Division for Population Health Sciences and the Institute for Circumpolar Health Studies. Today, I wanted to talk to you about our USDA grant called Building and Strengthening Local and Regional Food Systems in the Aleutian-Pribilof Islands region. This is in partnership with the Aleutian-Pribilof Islands Association, or APIA, UAA, and the Alaska Village Initiatives, or AVI. The overarching goals of this project are to better understand local food systems in the Aleutian-Pribilof Islands region and to begin planning and designing a regional food system through local and regional partnerships. Year one will focus on developing and/or adapting food system assessment tools in a collaborative effort between tribal partners and the project team. This will be with a number of the 13 tribes in the region. And the project team, or UAA, APIA, and AVI, will work with these participating communities to conduct food assessments and to facilitate some community dialogue around food systems in order to develop and build community connections, both public and private, share opportunities and challenges, and define the food system scope and structure. Year two will focus on completing these community engagement activities and analyzing local food system assessment results. In addition, APIA and UAA, as well as AVI, will convene tribal partners and other key stakeholders in the region in order to disseminate the assessment findings, to identify partnership opportunities both across communities and within communities in the region, and to identify priorities and avenues of sustainability for a regional food system in the Aleutian-Pribilof Islands region. We're very excited to get started on this project, and stay tuned.
Hi, I'm Dr. Brittany Howell, Assistant Professor of Population Health Sciences and Director of the UAA Healthy Aging Research Laboratory. We are currently in the midst of 4 different community engaged projects. The first is wrapping up a project that was affected by COVID-19, and it involved ethnographic field methods from an undergraduate student and myself conducting participant observation of older women's social experiences in water aerobics classes and trying to understand how they form and maintain those friendships and how those friendships then reinforce continued healthy behaviors and exercise patterns. The second project is called Community Wellness Breaks. We have been doing this in collaboration with the Department of Nutrition and Dietetics, as well as kinesiology for the past year and a half. And that project is currently being considered for expansion under a large NIH grant. And we should hear in a couple of months whether or not that funding has been awarded. The third project is trying to figure out a way to make one of our new COHI classes to be community engaged during a pandemic. So COHI stands for College of Health Interprofessional, and this is a collaboration between myself in Population Health Sciences as well as faculty in the kinesiology department to bring a course called Physical Activity and Aging to UAA. We were going to involve students in community projects, which may or may not be able to happen in the spring. And so we're looking at alternative delivery methods, including online coaching, as well as telephone coaching for older adults who would like some more health promotion and of people with dementia to develop positive coping strategies and to forge positive relationships with their loved ones through teaching improvisational comedy techniques.
Hi everyone, my name is Vanessa Mead. I'm in the University of Alaska Anchorage School of Social Work, and I wanted to talk to you about a project I've been working on and resources in the state of Alaska, as well as visibility around women veterans in Alaska. So many people don't know that Alaska has the highest percentage of women veterans per capita, tied with Virginia, in the country. And a lot of times women veterans aren't visible in our state. And so this project, Operation Mary Louise, we have a website, operationmarylouise.org. And we also have a way that you can sign up on there if you're interested in connecting with the operation. We're really trying to do outreach into the community with women veterans, the community being the entire state, including outlying areas, rural areas, villages. We have a lot of women veterans in our state that aren't seen or recognized, and so the project is really based in trying to increase that visibility. We also have, as part of that project, we have about 10 community-based groups that have been part of the steering committee. They're statewide agencies from the Department of Military Veterans Affairs to the state Military Veterans Affairs, community agencies, the Rasmussen Foundation, the Alaska Community Foundation have been funders of this project. And we have the website. We're doing outreach on Alaska Public Media, who's been amazing to work with around getting the word out about the project. So if you have any questions or anything, please let me know. It's vmead@alaska.edu, and you can contact me or through operationmarylouise.org. Thank you for the opportunity to talk today. Bye.
Hello, my name is Amana. I'm a multicultural postdoc fellow in the School of Social Work. Today we're going to talk about the Dancing Out Learning Center. And the Dancing Out Learning Center is an after-school program for 7 to 13-year-olds targeting students through the Multicultural Center. So it's either for their children or their siblings. And so, Paul, can you talk a little bit about the history of the Dancing Out Learning Center?
Sure, happy about it. So I'm Paul Wasco. I coordinate the portfolio work at the university, but I'm also a member here at the First Congregational Church. One Sunday, Reverend Poindexter challenged me to find ways to think about connecting the church to the university. It gave me an opportunity to reach out to some friends and colleagues at the university. One was Dean Ben Morton, Dean of Students, The other was Director Andre Thorne of the Multicultural Office, and the third was Director David Moxley for the School of Social Work. Had an opportunity to bring Jacob, myself, and those three individuals together to start brainstorming on ways that the church could support the efforts of the Multicultural Center in terms of engaging their students and really finding a way to connect the church into this university education community. In which case then I now hook Jacob into this conversation. He's provided, along with you, some of the leadership for the work.
Yeah, hello, I'm Reverend Jacob. I'm the minister at First Congregational Church, and along with Amana, we are interim co-directors of Dancing Gals Learning Center. The good news is that we recently were awarded 501c3 status by the IRS, and we are in the final stages of board development and starting to really solidify the relationships with community partners. So we look to start a Dancing Owls Learning Center as a real thing as soon as it's obviously safe and as soon as the children and students need us.
Yeah, so thank you CCL for supporting this effort. So we really appreciate and look forward to getting Dancing Owls Learning Center supporting students.
Terrific. And is there anyone here who was wanting to present today? We got to hear from Stacy earlier, but I just want to be sure. Okay, then I want to open the floor to discussion or questions that you may have for one another or comments that you'd like to make about some of the projects that you saw showcased in the rapid fire. You are a quiet group, which is okay. Thank you for being here. Go ahead, Stacy.
So I saw some folks, a couple of you guys asked about the donation closet and how to connect with that part. So that's a program that we support at SCF. And Amy Riley is the coordinating RN over there for gently used maternity clothes and baby clothes. They're always in need of like nursing pillows and baby blankets, and then buntings, like those little all-in-one snowsuity things. And her number is 729-6104. And they're doing it contactless type drop-off pickup because of COVID, but you can always call and arrange with her if you've got something, or if you've, made a baby blanket because you need to be crafting because it is the winter and the time of doing things. So, but that's sort of the easiest way to get involved in that part.
Other questions or comments? I have one for Stacy if no one else has another one. Stacy, I just was wondering if you have worked yet with the faculty who are teaching the OBGYN classes. Are there possible connections there?
I think there are possible connections. Margaret is one of the other founding members here, and we were talking just earlier this week about the need to do the like a train the trainer, a train providers, help them understand some of the things that are super colonial about the current approaches, and ways that they could be more supportive of their patients and of our families in the community. So not yet, but we're starting those conversations.
I'm in touch with both of the faculty who are currently working on the labor and delivery course, so I'd be happy to get you in touch with them.
I think that'd be awesome.
Okay, good. Other comments? final parting thoughts? Lots of good comments in the chat. Well, I just want to say thank you all so much for your participation and your continued support of community engaged learning. And I feel like you know, the challenges of the pandemic are ones that are substantial. There's no doubt about that. But at the same time, this moment of kind of turning inward and you know, working from home or having different kinds of really different lives that we're sort of leading right now gives us the time to look and think differently about the way that we want community to be and the connections that we want the university to have with the community when we get back to whatever a new normal is. And we can build that new normal in whatever way we want to. And I'm always so amazed and impressed by the wonderful projects that come out of CCEL. And I think that, you know, the rapid fires that we've had here in this session give us, you know, just a terrific taste of big projects that can be out there, right? I mean, we get only 2 minutes, but these are just fantastic. Any single one of them could be fantastic and could be, you know, a much more substantial work. And so I really appreciate everything that you're doing. And I'm very just proud to be part of this community and connected to all of the folks who are involved in this effort. It's really valuable work. And I hope that we will continue doing it for a long time. So thank you so much for attending Urban and Rural in Alaska, and the 8th annual one. Gosh, it's been, you know, it's amazing that it's been this many years. And although we knew we had to do it in a very different way this year, we really wanted to make sure that it continued this year. So thank you so much for your support for CCEL and for your projects, and we'll continue to keep this work going.